All right. Hello, everyone. Welcome back to another episode of CRNA School Prep Academy. I'm your host, Jenny Fennell in CRNA. It's so nice to see you guys again. Welcome back. And if you guys have been loyal listeners, thank you. I really appreciate that. Don't forget to go ahead and leave me a review. I really appreciate those reviews. It means a lot to me. So today we're going to discuss the CCRN. So many of you guys know about the CCRN, or if you don't, it's a critical care registered nurse. So it's a certificate you get for working in the ICU. You do have to qualify to be able to take it. And we're going to kind of go over the requirements of that today and kind of a little of the ins and outs of the test and maybe some things that you don't know that I want you to know. So let's go ahead and get into it today. All right. So ICU nurses have numerous certifications, and we're going to cover that a little bit later on as far as there are additional certifications you can get other than the CCRN. However, the most common one is the CCRN. Now, back when I applied to school, the GRE for the most part was mandatory at most schools. I do believe now that has, or I know, not that I do believe, I know that has changed. So now schools have shifted to requiring the CCRN versus the GRE. And so a lot of schools now will say required of the CCRN. However, there are still a lot of schools who say recommended the CCRN. So again, back to the whole recommendation versus requirement. It is a requirement because how competitive these schools are, you should get your CCRN. And so for those of you guys who are applying to school with, maybe barely 9 months of experience, I'm not here to discourage you from doing that. Rock it, do it. By all means. You won't be able to take the CCRN because typically to be able to take it, you have to have over, it's like 1,750 hours of direct patient care within the previous 2 years. And if you do the math, that's essentially full time as an ICU nurse for 2 years. So again, it's not something you can actually get if you barely have a year of ICU experience under your belt. But again, if your school does not require it and you have, by the time you interview, you will have met the year minimum of ICU experience or close to it, go for it. I mean, I'm not discouraging that at all. Plenty of nurses get in without the CCRN, but just know your overall application is my suggestion because again, it's very competitive. And so most of the candidates are going to have the CCRN who apply. So if you think you have something else to bring to the table that kind of can outshine that, then by all means, rock it. But again, the CCRN, again, is a really great kind of boost in your application, regardless of whether it's required or just recommended, okay? And so again, what are the requirements? The requirements, again, like I said, are 1,750 hours of direct care within the previous 2 years of acutely or critically ill adult patients. They do have a NICU and PEDS version of the CCRN. So just so you know. There's another option that they list as a 5-year option, and that is as a nurse or advanced practice nurse to have 5 years with a minimum of 2,000 hours of direct care with acutely or critically ill adult patients, with only 144 of those being within the last year that you're applying. And I also want to back up a little bit too. Sorry, I totally forgot this. So the whole 1,750 hours of direct care within the last 2 years, only 875 hours accrued in the most recent year prior to applying. So essentially, you could potentially have ICU experience, leave the ICU, come back to the ICU, and then take your CCRN. Okay, so that's what that means. And same thing with the 5-year option. You could technically have ICU experience, leave the ICU, come back to the ICU for a short period of time, and only after 144 hours of current ICU experience, you can then sit for your CCRN. That's what that means. Now, on the AACN's website, and again, if you're not familiar with the AACN, it's an American Association of Critical Care Nurses. I highly recommend that you become a member of the AACN. They not only offer great educational workshops, it's a good, if you're a critical care nurse, it's just the association you want to be a part of. It shows leadership skills. I encourage you to try to get involved in the AACN if possible, but at bare minimum, you should at least be a member as an ICU nurse. That's, I think. So based on their criteria, they want your ICU experience to be in the US or Canada or a comparable US standard of ICU is what they require. Again, they have all this information on their website, but I just figured I'd save you guys some steps here and kind of just tell you some of this. They also have a really helpful handbook of the CCRN that gives you all kinds of information as far as they'll literally divide up the test, different categories, and tell you within those categories exactly what kind of topics they're going to test on. I mean, it's very, very detailed, probably overwhelmingly detailed actually, but it's definitely a nice place to start if you're wondering what you're going to be asked, as far as what kind of test questions are you going to get. They also give you 8 practice questions. It's only 8 questions, but it still never hurts to go over those 8 questions and give you answers to those questions too. And so essentially the CCRN is a total of 150 question test. It's a proctored test. You have to go to a testing facility to take it. And they only score 125 of those questions. And passing is passing with an 83. So you have to get 83 correct questions out of 125 scored questions to pass the test. That's actually only equivalent to a 66%. Okay, so they're pretty lenient as far as what the passing score is. Now I will let you guys, this is what I want you guys to know, because most people don't know this when they take the CCRN, is that some schools actually want to know your score. Not all schools, but some schools will. So it's kind of nice to know this prior to taking the CCRN. That's why I've always stressed to you guys to research your school early. If you want to get to know your school early on, and if you don't know what school you're going to apply to, just research at least a handful of them to get to know what their requirements are, what their recommendations are. But either way, if you don't know and you don't know what where you're going to be applying, make sure you keep track of your score. Make sure you save that information somewhere, because some people are like scrambling when they're applying, trying to figure out how to contact the AACN to figure out how can I find out my score. Like, I don't remember what my score was, and I didn't keep that piece of paper. I didn't keep the email, so little tidbit, print it out, put it in a file cabinet, file it away. And another thing too, is some people are like, well, what if I barely passed? Well, they don't have to know that, but if they want to know the score, well, they're going to know. There's really no way around that. But if you barely passed and they're not going to ask you for your score, it doesn't matter. You passed. So you passed. You have the certificate. It doesn't really matter what you score. But it does matter if they want to know. So long story short, without me preaching to the choir, I'm telling you guys to make sure you're really studying for this test. Don't take it lightly. I think a lot of people are like, oh, I'll just wing it and see what happens. And if I don't do well, I'll take it again. It's expensive. I wrote on the price, $245 as a member of the AACN and $360 as a non-member. Ouch. Why would you ever just wing this test? Do not do that. Save your money. That can buy a lot of stuff. So yeah, I highly recommend that you take this seriously, that you study. There's all kinds of great resources out there to study from. A lot of people use, that's for the GRE. I'm getting my books confused, but I know like Lauren Gasparis has a great program. So does Nicole Kupchik, and I didn't write these down, so I'm kind of winging it off my memory here. Magoosh, Kaplan. I mean, there's tons of great resources out there. Just pick one. I don't think you need more than one. I think you just pick one and utilize it as much as you can. I know, like for me, I think I still have it actually. It's probably over here on my messy floor that you guys can't see, luckily. It's Kaplan, and it just was questions. That's all I did. It just read this book of all these different questions, and not that they were just questions, but it broke it up into sections and gave me study material along with questions per section. That's all I did. So again, don't kill yourself over getting multiple things to practice from. Just pick one and do it really well. You'll be okay. But yeah, just make sure you do study. Don't wing it. It's too expensive. And again, if you don't do well, if you get a score of 83% and then you find out later your school wants to know your score, like that's not, you just don't do it. Just telling you, don't do it. All right. So we went over that. So just to kind of give you guys an idea, they'll actually break up this test into sections. And so cardiac historically has been the most heavy hit section as far as it's just cardiac, and that's 17% of your test. There is an endocrine, heme, GI, renal, That's 20%, but that makes up a lot of different categories. That's why it's 20%, because they mash a whole bunch of stuff into one section. But if you were to actually break up all the sections as individual, like body parts, essentially, the cardiac section is by far the most heavy hit section. Just something to keep in mind, which I actually think is great, because CRNA interviews tend to focus a lot on cardiac as well. And every patient has a heart. So it doesn't matter whether you work in the SICU or neuro or medical ICU or anywhere, all your patients have a heart, and the heart plays an important role in any critically sick patient. So I think that's a great that that's actually heavily hit in the CCRN, because it's studying for the CCRN is going to also be equivalent to studying for the CRNA interview. Now, not all CRNA interviews hit heavy clinical, but you can't go wrong from studying some CCRN material prior to your CRNA interview, because it's very, very similar types of questions if they do hit clinical types of questions. Okay. Other things, I want to go over some other certifications with you guys real quick, just because I want to open up your eyes that there are other certifications out there. And so if you're looking for additional boosters, I have a lot of students who maybe come to me, maybe they get waitlisted, for example. And they're like, man, I don't know how else I can better my application while I'm waiting. And another tidbit for the waitlist, and I know I went over this in a previous episode, but don't just sit stagnant when you're on the wait list. You want to make sure you're reaching out, asking about, hey, what's the status? And you also want to try to look for things you could do to kind of add to your application. I mean, why not? It's only going to help you. And you'd be surprised. The vast majority of people who get waitlisted just don't ever follow back up with the school. And you really want to not only be following back up with the school to kind of figure out what you can improve upon, but it wouldn't hurt to get like maybe your CMC or your CSC or some other kind of certification, and then just submit it. Maybe it'll give you that extra little boost you need to have them be like, oh, well, this applicant didn't just sit still on the wait list. They're actually still going to CRNA conferences. They're still getting extra certifications, and so I think that would definitely be impressive. And if they had to pick someone randomly off the wait list and they saw one applicant was actively striving to do more, I would think that if they didn't have an order to the wait list, they would pick that one or that applicant. So anyways, extra certifications. I'm off that rant. So the CMC, that is the cardiac medicine certification. There's the CSC, which is the, it's if you care for a post open heart patient. So 48 hours post surgical cardiac surgery patients, you can take the CSC. There is also the CSRN. Did I say that right? Sorry, no, that's my dyslexia coming in right now. So it's the SCRN, the stroke certification RN. See, I told you guys I was dyslexic. I know I've talked about that. It's usually with stuff like this that I'm like, oh, I flipped those back. So yeah, that's the SCRN, stroke certified RN. There's also the TCRN, which is the trauma certification. There is something called the RNC, NIC, which is the neonatal intensive care certification. There's also this, like I said, the CCRN for PICU and NICU as well, just so you know. There is the CEN, which is this emergency nurse certification. There is also something that I think is kind of unique that I don't think a lot of people are aware of, but you can get this if you, especially the nurses who maybe have cath lab experience or EP lab. I'm trying to think where else. Those are probably the two main areas that I know gain this experience, is the a sedation nurse certification. So, endo would be another one. So not that that's ICU experience, but let's just say you worked in endo or cath lab or what did I say, EP, which is electrophysiology lab. If you worked in any of those areas, chances are you're giving conscious sedation as a nurse. Get certified and then go to the ICU and get your ICU experience and have your CCRN. I think that'll definitely give you a cutting edge and something kind of unique about your application. So again, if you have that experience, try to make sure you're getting these certifications. And so, yeah, I think that kind of sums it up for you guys, about the CCRN and maybe any additional certifications. Definitely something that you want to have if you can get it. But again, there is that minimum time requirement to actually get your CCRN. So I hope you guys found that helpful, and you guys all have a good day, and we'll see you next week. Bye-bye.